A very good evening to all the dignitaries present over here, to the respected faculty members of various colleges, governing council members of HMAT, and all the students. So before jumping into today's program, let us start with a nice quote. So what is today? The importance of today. Mostly we forget many things in life. Many things we tend to forget. But today, let us remember those who usually tend to forget, that are Alzheimer's patients. So today is World Alzheimer's Day. So what is the importance of today? What is our role in Alzheimer's patients? So today marks the importance of those who can't do their daily activities by themselves because of the issue in their memory. Today, we need to enhance support to those who provide support to the Alzheimer patients. We need to enhance our acknowledgement and improve the awareness of Alzheimer's in everyone. So let us remember them and let us acknowledge the fact that they require our support to the fullest. So let us begin our program. Now, I request, first of all, our President, Dr. Gopal Krishna Garu, to please come onto the dais. Welcome, sir, with a big round of applause. Now, I call upon our General Secretary, Dr. Durga Prasad Rao Garu, to please come onto the dais. Now, I call upon the speaker of today's session, Dr. Mohammad Irfan, sir, to please come onto the dais. I request our ICRH Clinical Director, Dr. Venugopal Gauri, sir, to please come onto the dais. I request the sponsor of today's event, Dr. Manik Prabhu, sir, to please come onto the dais. Give a big round of applause for all the dignitaries on the dais. I call upon the veteran homeopath present over here, Dr. Annapurna Wagre, ma'am, to please come onto the dais. Please give a big round of applause for such a great personality. I also like to call upon Dr. Mulli sir onto the dais. Please welcome sir with a big round of applause. I also call upon Dr. Surya Prashant sir to please come on to the dais, the sponsor of today's event. Sir, please come on to the dais. Please give a big round of applause. So before starting any event, we need to remember the name of God and acknowledge his presence. So now I call upon Dr. Harshita Bure ma'am to please come on to the dais for the prayer song. Please welcome her with a big round of applause. तू ही राम है, तू रहीम है, तू करीम कृष्ण खुदा हुआ, तू ही वाहे गुरु, तू यीशु मसीह, हर नाम में तू समा रहा, तू ही राम, तू ही राम। तेरे जाते पाक कुरान में, तेरा दर्श वेद पुराण में, तेरी जात पाक कुरान में, तेरा दर्श वेद पुराण में, गुरु ग्रंथ जी की बखान में, गुरु ग्रंथ जी की बखान में तू प्रकाश अपना दिखा रहा, तू ही राम है, तू रहीम है, तू करीम कृष्ण खुदा हुआ, तू ही वाहे गुरु, तू ईशो मसीह, हर नाम में तू समा रहा, तू ही राम, तू ही राम, तू ही राम, तू ही राम. Thank you so much, ma'am, for such a melodious beginning. Now, I request all the dignitaries on the dais to proceed for the light lamping ceremony and paying tributes to Dr. N.M. Jayasoorya. Thanks to all the dignitaries. Now, I request our President, Dr. Gopal Krishna Garu, to please come to the podium and present the welcome address to the audience. Welcome with a big round of applause.
Good evening, ladies and gentlemen. Respected Professor Dr. Irfan, our distinguished guest of this evening, and Professor Dr. T. Murali, our good friend, revered teacher, and going to be awarded a best teacher of this year. And our veteran homeopath, and a great service for several decades in our association as a consultant, Srimati Dr. Annapurna Vagre, and our General Secretary, Dr. Durga Prasad Rao, our ICRH Director, Dr. Venugopal Gauri, and today's sponsor, Dr. Manik Prabhu and Dr. Prashant of Surya Homeo Pharmaceuticals and Stores. So, and dear friends, and all the faculty members of different colleges, postgraduate students, practitioners, and interns, and all homeopathic lovers. A hearty welcome to you all to this JAYSOORYA Memorial Oration and also Manik Prabhu. So today we have a very popular and eminent doctor with us to deliver on the relevance of observations in pediatrics. He has been working in JIMS Homeopathic Medical College and a very popular clinician in that hospital and very learned man. To his credit, he has many papers presented. So on this occasion, I wish we would be immensely benefited by his sharing of his experience and the deliberations. So, Dr. JAYSOORYA Memorial Oration. So, Dr. N.M. JAYSOORYA was one of our founders. So, hope every one of us know who Dr. JAYSOORYA is. He was son of a Nightingale of India, Srimati Sarojini Naidu. So he was a parliamentarian, a trade union leader, a great humanist, and also homeophysician. So in fact, he studied allopathy in Germany, but later he turned towards homeopathy, and till his death, he practiced homeopathy. And he also made several contributions in the promotion of homeopathy in the parliament, in the enactment of the bill for homeopathy, and in the state for the recognition by the government to the system. So his contribution is monumental. On this occasion, we pay our heartfelt tributes to him and we thank him for rendering such great service. And that's why we have our college named after him, Dr. JAYSOORYA and Poti Sri Ramalu. So such great person he was. So we once again pay our tributes to him. And we thank the sponsors, Dr. Manik Prabhu and Dr. Prashant, Surya Prashant, for generously donating to organize the event on this occasion. So we profusely thank them for their generosity. And thank you all for having come here to participate, witness the deliberations by Dr. Irfan. Thank you all.
Thank you, sir. Now I call upon our General Secretary, Dr. Durga Prasad Rao, sir, to please come to the podium and introduce about HMAT and today's oration to the audience. Welcome, sir, with a big round of applause.
Good evening, all. Respected President Dr. Gopalakrishna sir, and today our beloved speaker, Professor Dr. Muhammad Irfan sir, our ICRH Clinical Director Dr. Venugopal Gauri, and our Principal of Dev Homeopathic Medical College, and today outgoing outstanding educator award Professor Dr. Murali, and senior female homeopath, veteran homeopath Dr. Annapurna madam, and sponsor of this evening, Dr. Manik Prabhu and Dr. Surya Prashant, and distinguished guests, Professor Dr. Srinath Rao sir from Jim's College, and Dr. Mahavi from Dev's College, and all the other governing council members, and all the doctors. At the outset, let me pay my heartiest tributes to the great souls, beginning our Dr. Father of Homeopathy, Dr. Haniman, and Dr. N.M. JAYSOORYA, the founder of, one of the founder members of HMAT, who initiated this association 60 years back, Professor Dr. N.M. JAYSOORYA, and we pay rich tributes to the great souls being our predecessors. As you are all aware that the HMAT is conducting, has been conducting CL Modi Charitable Dispensary for the last 5.5 decades, and also some of the specialty clinics on particular days, inviting senior homeopathic doctors from the Twin Cities for the 2 decades. And also we train the house physicians posted by the homeopathic colleges like Dev's College, Hamsa College, JSPS College, etc. And other thing is we do conduct free medical camps whenever in other associated with other organizations, the periodical national level and state level seminars, and also distribution of preventive medicines during the epidemics and pandemics. And all these activities are under one roof for the last so many decades. And the Institute of Clinical Research, also our academic and research wing, where our clinical director, Dr. Venugopal Gauri, is looking after that clinical research department. We have completed one CCRH research project on urban the population with depression in urban population. Successfully conducted that, completed that project. And with so many activities, we have been doing this, all these activities with the support and the cooperation of philanthropists and so many well-wishers and our Lomio lovers. And today, particularly to say about Dr. JAYSOORYA, Dr. JAYSOORYA, to introduce Dr. JAYSOORYA ji, myself, I feel very great, because one of the followers of Dr. JAYSOORYA, Dr. P.S. Krishnamurthy, was my guru. So that I could able to know what Dr. JAYSOORYA was and what was his contribution and what was his personality. Dr. JAYSOORYA Naidu was the illustrious son of Srimati Sarojini Naidu and Dr. Mutyala Govindarajulu Naidu, a noble practitioner in Twin Cities. And he was not only a medical doctor, he was also a socialist worker, a great politician and journalist, and he represented from Medak constituency in the first Lok Sabha in the Nehru cabinet as a MP from the other sector. And first time he was instrumental in bringing the official recognition to homeopathy in India, particularly first time in Andhra Pradesh. After Andhra Pradesh only, India got the official recognition in homeopathy due to the good efforts of good office of Dr. N.M. JAYSOORYA and some others. And he was the first person to develop so many homeopathic dispensaries in Andhra Pradesh, to increase the homeopathic dispensaries on behalf of government. And also, on his name, Dr. JAYSOORYA College was instituted, and later on it was taken over by the government. And after that, it was merged with Sridhamlu. Now it is called JSPS Government Homeopathic College in Twin Cities. He was the first qualified medical man to choose the homeopathy from our whole country, because in those days, allopathic doctors were very rarely they were coming to homeopaths, and they know very little about homeopathy, and even knowingly also they were not showing any interest to support homeopathy. JAYSOORYA was the first person, being a MD in pathology from London, England, and after practicing some years of allopathic practice, he switched over to homeopathy, and he trained many homeopathic doctors. He was a Pandit in Materia Medica, and he was very popular in the drugs and the drug pictures and out of the way remedies also. He was having a rock-like faith in homeopathy because unfortunately he died at his 64th year age due to the ignorance of the attending surgeons who opened his abscess on the leg without knowing that he was consuming this anticoagulant tablets. Then due to profuse bleeding, he went into shock and lost his breath. And while arranging for the blood arrangement also, last moment he died with speaking aconite on his lips. So we can understand the last moment of in the death time also that only preferring homeopathy is that was his strong faith in homeopathy. We can understand that how he was convicted with homeopathy and how he was believing homeopathy. And we are lucky to continue his legacy here after the 60 years also. Today we are able to continue his services here, which he started this association, and we are lucky enough to move on for future periods also, and we wish to continue the same with the same tempo and same this efforts. This month the other oration besides JAYSOORYA Jayanti oration or Surya Manik Pharmaceuticals and Surya Teja Homeo Stores Hyderabad. You know they need no introduction. They are big entrepreneurs in the market, homeopathic market in the India, and the popular manufacturers and dealers also. And I am thank you, Dr. Manik Prabhu and Surya Prashant, for your generous contribution to hold this oration in the month of September. And today our speaker, Professor Dr. Mohammad Irfan sir, is going to enlighten us on the relevance of observations in pediatrics. So let us take the chance to hear his presentation. And besides the regular contribution, and Dr. Manik Prabhu is sponsoring IT also today. So we thank you once again. I thank all of you for your enrolling this occasion and coming. Lastly, I thank all the sympathizers and the other homeopathic lovers who are giving their unconditional support at all our endeavors. So thank you very much.
Thank you, sir. Always we hear names of stalwarts, but when we know about them, we'll understand their greatness and the efforts they have put in, and they will be a pathway for inspiration. Thank you so much, sir. By introducing Dr. N.M. JAYSOORYA, you have inspired many young homeopaths here to understand the importance of homeopathy and how it has come to our state. Thank you so much, sir. So now I like to call upon Dr. Annapurna ma'am to introduce about the speaker, Dr. Professor Mohammad Irfan sir, to the audience. Welcome, ma'am.
Thank you, Dr. Chamundeshwari. A very warm welcome to everyone. It's a pleasure and privilege to introduce our guest speaker today, as I have experienced learning under sir when I was in Dhawale College. We had the privilege to learn under him. He was the medical officer of pediatrics department with a huge and immense amount of practical knowledge working in NICUs and all. So it's a privilege today to welcome our guest of honor today. Welcome, Irfan. So a short summary about his professional achievements. Sir has completed his MD Homeopathy in Pediatrics from Dr. M.L. Dhawale Homeopathic Medical Institute, Mumbai in the year 2007. Sir has a number of important certifications with a fellowship in palliative care, ethics review of health research, foundation certificate in palliative care. So apart from pediatrics, sir has an immense vast experience in palliative care as well. Maternal infants and young children nutrition from IIT Bombay, and a few other certifications along with it. As currently, sir is working as a professor and HOD pediatrics, JIMS Homeopathic Medical College and Hospital, Hyderabad. Sir has been doing a lot of clinical training and internship coordination works at gyms from the year 2023 to present. Among significant previous experiences, Sir has worked as a medical superintendent at Gyms Hospital, Hyderabad. Sir has an experience of a professor, associate professor in practice of medicine. Sir was also a senior medical officer and lecturer at Gyms. Amongst his research and publications, some significant ones are, he was a site investigator in homeopathy versus conventional primary care in children, which was a RCT published in European Journal of Pediatrics. Sir has also written a number of case reports in various esteemed journals at the national level. Sir has been a keynote speaker for Homeopathy in Palliative Care Swasthya Ayush and Wellness Expo, Hyderabad 2023. Amongst the other selected talks, Sir was a speaker at national, international CMEs on pediatrics, neonatology, emergency care, and integrative medicine. Amongst various projects, Sir has done COVID-19 community prophylaxis and data reporting, CCRH, from the year 2020-2021. Sir has a lot of research projects on diarrhea, scabies, and school health in collaboration with TISS and Ayush. Among the significant awards, Sir has received recognition award for contributions to homeopathy by H.H. Shri Tridandi Chinna G.R. Swamiji in 2016. So with an expertise in pediatrics and his passion for teaching students, we have a speaker here today evening, Dr. Muhammad Irfan sir, and I kindly request everyone to welcome him with a loud round of applause. Welcome.
కొంచెం పైకి ఇది మాకు
Good evening, distinguished guests, Dr. Mohan sir, Dr. Annapurna ma'am, all the members of the organizing committee of HMAT. It's a great honor to be standing here with the Dr. N.M. JAYSOORYA sirs. Centenary oration. Thank Durga Prasad sir for enlightening us with his life's history, which gives us immense pleasure to be all called as homeopaths. Because of his contribution, we all are here enjoying the various fruits of homeopathy in this state. So the topic for today is relevance of observations in pediatrics. So this uh, topic I've selected because what we see in a day-to-day practice, we all are practicing, and when it comes to uh, observations, so observations, we all have a lot of observations, and when we take the entire case in detail, so we come to some conclusion about the pattern of the patient, right, of understanding the patient. But it comes to coming to a conclusion about selecting the right simillimum. We also have to base our totality on understanding the demeanor, the body language, the observations what we have, and more so, this is very important in pediatrics, right? Let us start with understanding why is it important. Yeah, we need to point it here. Yeah. Sure, no problem. So objectives of today's presentation is to understand the importance of the correlation for good history taking, impeccable examination and observations, and relevant investigations. So a combination of all these three will help us to understand the patient in toto. Okay, so and using these knowledges in understanding aphorism number 3 and aphorism number 6 of the Organon of Medicine, as illustrated by Dr. Samuel Hahnemann. And also to understand the importance of bedside training in IPD setting in an homeopathic institute. So this is very important for all the homeopathic teachers from various colleges who have come here, because I want to stress upon the importance of bedside training, which is quite relevant in these days, because I see most of the students after the pandemic have stopped touching patients, right? So I think most of the teachers who are here agree with me that bedside training has taken a backseat when it comes to examining the patients, understanding the patient in a better way, correlating the history and the examination findings. So when it comes to sense organs, we all see that this is just an eye-opener for all of us to see that we all have all these sense organs. And what are the basic importance of these sense organs is that eyes, we are all using them to see. But when it comes to an analytical understanding of what we see is what we observe, what you call it as observation. Similarly, when it comes to ears, we hear from the ears. When you're talking and we want some apt attention, we always use it in common parlance. Please listen to me, right? We don't tell, please hear me, right? So when it is coming to an analytical understanding of what, how we are using these sense organs, it is always important to understand that when it comes to having a deeper insight of all this, using these sense organs to the fullest will help us to understand the patients better. Smell, we appreciate when it comes to analysis. When we eating something, if we enjoy, we relish the food. Okay, otherwise we are just tasting the food. When it comes to touch, skin, we touch the patient when we feel the pulses, or when we feel the tenderness, when we feel the pulsations, when we feel the different parts of the body, then we understand how much important it is to understand the patient from their expressions, from the changes when we see when it comes to the physical examination. Next slide, please. So coming back to pediatrics and history taking in pediatrics. Pediatric history taking involves several unique considerations compared to adult history taking, as most of the children may be unable to communicate effectively, and the history often relies on the parents or caregivers for information. So most of the times when we are interacting with the patients, when we take the cases of pediatric patients, okay, so we also involve the data and corroborate with the patient's parents' history or patient's data which comes from the parents, and try to understand the patient from a total perspective. Next slide, please. It's working. Thank you. So this is what I was talking about. This triangle has to be understood very much to understand the diagnosis. So very good history taking with observations and examination findings and investigations whenever relevant will come to a proper understanding of the diagnosis. Okay, so any part of this triangle which is missing will give a half knowledge or half understanding of the patient. I hope most of you have heard of the famous British detective Sherlock Holmes. In one of his novels, there's a paragraph which says, when he and his assistant, Dr. Watson, they were interacting, Dr. Watson once asked him, we all see the same cases, we all visit the same sites, and we all try to gather the same evidence. How is it that your observations, your knowledge is more important and more valuable than what I perceive? So he said, when you come to my house and you climb the steps, have you observed how many steps are there? He said, I've never counted them. So that is the difference. You climb the stairs and you see the steps, but you never observe what is it. I observe things better than you. So that is what makes me different from you. Right? So that is the importance of observations. So in pediatrics, observation is not just about seeing symptoms. It's about listening to the child, observing their behavior, and understanding the subtle clues they give us. This approach is at the heart of homeopathic practice, where we treat the child as a whole. Of course, this holds good for the adults as well, but when it comes to the children, we have to have understanding of the entire case, not just the illness. And this is the little voices of children, which in pediatric homeopathy, the homeopath must become a skilled, unprejudiced observer. Dr. Samuel Hahnemann says in the aphorism number 6 about being unprejudiced observers. Right? Unprejudiced observer itself is a huge topic which can take more than 2-3 hours to discuss upon. Okay? When time permits and if invited sometime later, I can discuss this topic as well. So this, to understand the children's little voices, the subtle unspoken expression of their illness. This involves paying attention to the details that might seem insignificant in the other medical contexts. Right? In the modern medicine, they just see the symptoms and try to come to a diagnosis, collaborating with the investigations. But when it comes to homeopathy, these little clues which the patient gives us in the way of their expressions, in the way of their body language, and in the way of their interactions, gives very relevant data for us to understand the history. So what do we perceive by observations? Right? We observe the general appearance, the build, the nutrition, the deformities, the behavior, right? How the patient is behaving inside the OPD as well as in the waiting area, the shyness, the irritability, playfulness, and stubbornness. This every time you need not ask the parents. This is quite evident even in your waiting area. While you're seeing the other patients, you might see this in the waiting area as well. So the clinical case taking in pediatrics starts right from the OPD waiting areas. Okay, your observations in the waiting area have to be re-questioned to the parents about their behavior at home as well, whether it is same at home, whether it is different outside. So all this will give clues to the various simillimums. Okay, the non-verbal cues, the gestures, the expressions, the restlessness, and the posture, right? What I usually do is try to shake hands with the patients. Yes, most of the children try to shy away. Most of them try to eagerly come and shake hands. When they come next time also, they want to first shake hands and then start talking. So all these are important observations in pediatrics, which give important clues to understand the simillimums. Interaction with the parents, how they interact with the patient, parents at home or in the OPD in front of you, interaction with you as doctors and the environment. Okay, what we usually do is we also give some paper and pen or some color pencils to the patients who try to draw, because most of them try and want to draw something. Okay, so when we draw something, we also get time to interact with the parents, right? So that is a way of distracting the children, not to disturb you during your case taking and not to disturb the parents as well. So in such one incident, I remember a child who had drawn a simple drawing. Okay, so there was a house, a typical picture of a house, a coconut tree, some road, and some trees around, bushes. And there was a cloth line which had cloths drying in the sunlight. He colored all the clothes except one. So when asked, what is the that you have forgotten to this? It's the one white. So that is one important aspect. How children also observe things in life, right? A small child has such relevant observations. So as homeopaths, we should also develop this art of observing things. And the reaction to pain, to strangers, and to consolation. We can differentiate between drugs like Sina, chamomillas. So coming to case one, three important cases. And the first case is about a young 10-year-old boy whose parents had come at complaining that since the age of 2.5 years, they have observed lack of communication, no eye contact, talks irrelevant when alone, and lack of attention. Okay, so this is the basic complaint which the patient's parents have brought him to us. And it was a diagnosed case of autism. So I'm not going into how to approach the case of diagnosis of autism. It is a clear-cut case of autism. But I just want to highlight few things in this. As the history says that the lack of communication and lack of no contact, all this started during the pandemic, where the child was mostly involved in watching mobiles. Okay. And he gives irrelevant answers when he is asked. Like when he is asked for his name, he answers about his some calculating numbers. Sometimes he laughs continuously and loudly by looking at people without any reason. Plays alone and he likes it. He plays mostly with water repeatedly. He is able to ask what he needs. Divert frequently from the current work, forgets and leaves. He writes continuously while talking to him. During the case taking also, he is continuously writing, either drawing things of some gods or goddesses, or continuously writing something or the other. And in during that time also, he's quite observant of what I am interacting with the parents. Okay, so in between, he just suddenly talks about something. Okay, he suddenly gets emotional and cries, remembering something bad. And he gets irritated, he cries and starts jumping. Okay, so this is the data which has been got. There are other relevant data which I'm not taking up right now, because right now I'm focusing only on the observations and the relevance in this case take. So based on this, we had formed this totality of fear of action scenes, dark or immoderate laughing, drawing pictures without looking, obsession with cleanliness, sudden emotional outbursts, desires sweets and papayas and fruits, passes urine in pants consciously and sometimes in the mornings, sleep pattern, he covers his face, talks irrelevant to himself, not answering when asked. Okay. After this totality, we try to repertorize as we do for all the cases. So this was the repertorial analysis, and there are so many remedies when we come to the understanding the person from the repertorial analysis. But repertory is not the final court of justice, right? We have to go back to materia medica. But while we're studying materia medica, we also observed that there was one important observation which we made while he was interacting with us. Every time he came, his speech was quite soft. He was talking very softly and very respectfully. Okay, so whenever he came to us, Dr. Muhammad Irfan, when is your birthday? And this is the typical tone which he uses. Okay, so he always tries to talk in this particular manner. So when we see this rubric and we concentrate on this, where is it? This is only one drug in this particular rubric, and that is agaricus. So we have started giving him agaricus frequently and infrequently, and now he's doing quite good. His interaction has improved. He's still under treatment. You're not claiming that agaricus has been the complete understanding of the patient. As then when the case evolves, we might come to some different simillimum as well. So agaricus has helped this child, and parents are also appreciating that there are definitely changes in his behavior as well. Coming to the second case, this is an important case where we want to highlight the importance of observations in pediatrics, particularly in skin conditions. So this is a 3-year-old boy who presented with eruptions all over the body. JIMS Hospital has adopted 24 villages where we send out students, interns, PGs, and faculty members to cover these villages on a daily basis. Okay, so this patient had come from one of such village where this patient was brought to the hospital. All these patients who come from these villages, 24 adopted villages, are given free treatment, free investigations, and free food at gyms when they get admitted in the hospital. So this boy also was admitted. Now, when we see a skin condition, most of us do not think about admitting a skin condition, especially because it is most of the times treated on OPD basis. But why was this patient admitted is because we had to show the relevance of observations to our PG students and to interns and students, where we try to analyze the symptoms and correlate with them with the observations of the skin pattern, skin eruption history, and try to correlate and see how the simillimum works. So that is the reason that we admitted this patient. Coming to the history, so the patient had fever a week back, and after that, which the eruption started, he was taken to a local doctor and was started on the regular medicines, where he was given some suspensions and lotion for the skin. And after the medication, the fever came down because of the paracetamol, but the eruptions were persistent. And at the time of his admission, there was no complaints of fever. Now, coming to the observations, we also have to see what are the type of eruptions, how they have evolved. So evolution of the eruptions also matters when we try to understand the skin conditions. And there are, you see, a pleomorphism of eruptions. Okay, you have diffuse maculopapular eruptions on the back, chest, and extremities, papulovesicular eruptions on the right ear, pinna, face, and upper extremities, serous and offensive discharge from the eruptions of face and extremities, and serous discharge and bleeding from the eruptions on the ear pinna. Okay, so these are the various eruptions which have been seen all over the body, and different locations, different type of eruptions we have. And coming to the history, the eruption started on the webs of the fingers on the right hand, then spread to the left hand, and then to the rest of the body. Started initially as scaly eruptions on the webs of the fingers, and later maculopapular eruptions and vesicular eruptions developed all over the body. There was severe itching with burning pain. The child would continuously keep scratching without stopping, and there was itching mostly at night that the parents have observed, and concomitantly there was swelling of the face. Okay, and there was no history of any food or medicine intake before the complaint started. Coming to past history, this child also had recurrent episodes of URTA on and off after taking cold food and drinks, which is quite common at this age. Family history, mother also had similar eruptions 1 week after coming in contact with the patient. There are 2 elder siblings, 7 and 5 years old. The 7-year-old brother is staying in hostel. 5-year-old brother also has similar skin complaints like patient since last 1 month. Okay, and father has a stasis eczema. And we come to the case, we see that there are physiological generals which we observe, and we have to see to form the totality, alteration in these physiological generals. So when it came to this patient, there was only decreased appetite in since the complaints have started, and increased perspiration since these complaints have started. Coming to the mentals, there was quite restlessness. He quarrels with his brother, makes sure that he gets what he wants. Quite stubborn child as compared to his elder brothers. And very particular about dressing, wants his mother to dress the way he likes. Always prefers wearing jeans, fearless, hits animals, throws stones at the dogs and pulls dogs by the tail. Does not obey his teachers and parents' words. Does things only what he wishes to do. Angered when he is not given what he asks, beats others. So this is basically understanding how the child has evolved since childhood and what is his pattern at home. Okay, even during the admission in the IPD, he was quite restless, running here and there in the ward. And whenever he saw the doctor, he was sitting on the bed quietly. Coming to the examination, the puffiness on the face, which was part of the chief complaint, and more so it was on the right side. And there was eruptions on the right ear pinna, serous discharge and bleeding at times with pus. His vitals were fine. And coming to the skin examinations, as I've told you already, there are different types of eruptions on different parts of the body with different types of discharges. So this is the child. You see this right side of the face is swollen, and these are the eruptions you see. Okay, there are quite number of eruptions inside the ear pinna as well as on the face, and this you see on the chest, which is already broken up and formed a scab. This is on the back chest, and this is on the back. And few eruptions on the feet. These eruptions which are already broken up, and the scaling as well as you see these web spaces. So what is the diagnosis? Everybody is aware that this is a case of scabies, but it is crusted scabies with secondary infection. Right? Usually the scabies, as a evolution of this patient also is showing that it starts from the web spaces and covers the rest of the body depending on the immunity status of the child. And if the immunity status is quite low, then it might also develop into a secondary infection, the bacterial infection, which produces the fever. So when it came, again, this prescription was based on totally on observations. Okay, so the observations was that the eruptions ulcerate and form thick scabs under which the purulent matter exudes. Intolerable itching with burning, aggravation in the night. Any guesses? What is the remedy? Sorry. Marxol is a good choice. Yes. Meserium. Yes. Arsenic iode. Yeah. Like most of you have guessed, we gave this child Meserium 30. We started with one single dose because the child was with us. We want to see how the child responds to the medicines. Okay. Otherwise, we usually give it in multiple doses in acute cases when we are treating in not OPD basis. And we wanted to see the changes. We always form a follow-up criteria to see what are the changes, improvement in generalities, relieving the complaints like itching and controlling the spread of secondary infection. Because the child is already has a secondary infection, there will be chances of falling into sepsis. So that has to be a caution which we have to deal when we are treating such cases. So looking at the follow-ups, the next day the eruptions were same, itching and burning, pain was same, and offensive discharge was still present. We continued as TID. And on the next day, the eruptions discharge from the right ear was thick yellow discharge, itching and burning, but the appetite has improved. So when you give a simulimum, if there is a change in the generalities, that is a good sign that the simulimum is working. As with my personal experience, I usually see that when a biochemic is added with the simulimum, that usually enhances the cure or the road to cure. So I added Kalisalp, which was also a good remedy for discharge, the type of discharges which this patient had. So the next day, the discharge from the eruption in the right ear had reduced. The itching was 40% better. So we moved on to the next potency, 200 TID, along with Kalisol. And on the 6th, the discharge from the eruption on the right ear was very scanty. Itching reduced by 60%. Eruptions decreased by 40%, and puffiness also had drastically reduced by 60%. So we kept him on 200 Kalisol and Meserim 200 and Kalisol 3x QDS. So by 7th morning, there was absolutely no discharge from the ears. And the puffiness of the face had completely reduced. Itching was still present. Eruptions were still present, which will take some time to go away. And on the parents' insistence, we discharged the patient on placebo. And the patient was asked to come back on after 1 week, but when the patient didn't come, the next follow-up was in the peripheral OPD in the village. And we see that the child had no discharge, no puffiness, no complaints of itching, and all the eruptions had gone. Only scar marks of the eruptions were present in the right ear. So this is before the treatment. On 2nd, when the patient came to us, and this is during the treatment. You see this eruptions which we have shown you, and this is during the treatment. You see the drastic changes in the eruptions pattern, as well as there's absence of discharge. And now you see after 2 weeks of treatment, this is the condition which the patient has. You want to break, sir? Sir wants to leave. This is a little long case, sir. Break? Okay. We'll continue after the felicitation of sir. No, sir.
Now we are taking a brief break to complete the felicitation process. So first, I would like to call upon our President, Dr. Gopal Krishna sir, to please come onto the dais. Our General Secretary sir, ICRH Clinical Director, Dr. Venugopal Gauri sir, Dr. Raghuram sir, Dr. Manik Prabhu sir, Dr. Surya Prashant sir, to please come onto the dais for the felicitation. Please give a big round of applause. And simultaneously, I would like to call upon Dr. Sai Shruti ma'am to introduce about the award winner, Dr. Muli sir.
Good evening, everyone. Dr. Murli sir completed his BHMS in 2003 from Government Homeopathic Medical College, Kadapa, and he completed his MD in Materia Medica from JSPS Government Homeopathic Medical College in the year 2008. Sir has a teaching experience of 14 years and clinical experience of more than 20 years. At present, sir is working as Vice Principal at Dev's Homeopathic Medical College and Hospital, Ankireddypalli, Kisara from 2019. Sir worked as a Senior Research Fellow from 2009 to 2012 in a EMR project, CCRH, under Ministry of Health and Family Welfare, Government of India. Sir published an article in Homeopathic Links International Journal titled Evaluation of Homeopathic Approach in Depressive Disorders in Hyderabad Urban Population, which is published in the year 2019. He is one of the organizers in conducting national-wide seminars like Depressive Disorders and its Homeopathic Approach in 2008 and Homeopathy in Emergency Medicine in 2010. Sir has written articles in various national and state journals, both in English and Telugu. Sir worked as a resident editor for the journal Medicina Futura Homeopathica, a monthly journal published by Homeopathic Medical Association of Telangana, Hyderabad for 1.5 years. Thank you, sir. Sorry, sir is presently working as a principal at Dev's Homeopathic Medical College.
Today, this honor is on behalf of HMAT, is due on the occasion of National Teachers' Day in India, 5th September. In commemoration of National Teachers' Day, we are honoring with Outstanding Educator Award to Dr. Murali Garu. And coming to National Teachers' Day importance, once Sri Balagangadhar Tilak, he was working as a Sanskrit teacher in Pune, and before independence is going to be announced, the reporters went to him and asked, "Sir, India is going to get the Independence Day. What would you want to become? You want to become Prime Minister, Home Minister, or some other minister?" Then Balagangadhar Tilak replied, "When I am as a teacher, when I am able to make many Prime Ministers, many Home Ministers, and many other ministers, what the necessity of going to politics? Let me be in my profession as a teacher." That is the importance of teachers. So thank you, Murali Garu. Thank you for your. And I request Dr. Madhavi Garu also to just accompany the better half of Dr. Murali Garu, just to honor your presence. It is a token of respect.
Good evening, one and all. Respected President Sir, Gopal Krishna Sir, Secretary Durga Prasad Sir, and Venugopal Gauri Sir, and other HMAT members. On the occasion of National Teachers' Day, as the HMAT is facilitating the best teacher awards are the person who is in the institutions. This time I got this opportunity and I have a great bond with this HMAT institution for many years. And see this award, first of all, I'm blessed to have this award. I'm thankful to all my parents and teachers and students, because without students, we can't be a teacher. Generally, my childhood began with teaching only, because we have one private school. So directly or indirectly, I'm attached with teaching. More than, I can say, 40 years, not 14 years or something. So my childhood started like that. So the first point of what I learned means, because whenever I was teaching to my colleagues or anybody, so always there will be great people ahead of us. మనకంటే గొప్ప వాళ్ళు చాలా మంది ఉంటారు, కాబట్టి నువ్వేం నేర్చుకున్నా అది ఇక్కడ వరకే ఉండాలి. ప్లీజ్ డోంట్ క్యారీ యువర్ అవార్డ్స్ ఆర్ రివార్డ్స్, క్యారీ యువర్ వర్క్. దట్ ఈస్ ద మోటో సెట్ బై మై టీచర్స్. So work always when I go to college, I should think about what I have to do. It's not whether you are a position or anything. So these are clinical. Whenever we go to clinic, we should do our best to serve the patients or to do best. So this award to everybody. And at the same time, I am thankful to all my staff members, management, Ramred sir, and other my staff members who supporting me to run this institution and all my students. Thank you.
Thank you so much, sir. Whenever a student wins an award, a teacher will clap louder and harder. So today, when my teacher got an award and all the students, they would have experienced that proud feeling, that happy feeling in the chest. I can't explain. It is very proud for all of us, sir, to be a student. Thank you so much for your presence, and once again, congratulations. And we acknowledge the presence of Vice President IIHP, Dr. Kaladhar Garu. Now, we also have one more award. So before that, I would like to call upon Dr. Gautam Ralabandi sir to please come on to the dais to introduce about Dr. Annapurna Vagre ma'am.
Good evening, everyone. It's a privilege for me on behalf of us Homeopathic Medical Association of Telangana. I got this opportunity to share a few words about a veteran homeopath associated with HMAT, Dr. Annapurna Vagre ma'am. She has completed her DHMS in 1975 from JAYSOORYA Homeopathic College, immediately joined under Dr. Seshachari sir as a trainee in CL Modi. She has finished her house surgeonship in June 1976 and started her own practice in Old City. Ma'am has completed a degree course from Nagarjuna University BHMS in 86, started practicing at Sagar Homeopathic Stores as a consultant in January of 1984. Ma'am pursued her MD in repertory from Dakshin Kesari Muni Mishrilalji Homeopathic Medical College, Aurangabad, and has been practicing since last 50 years. Also, ma'am have pursued her MA from Osmania University and is an honorary consultant at Dr. CL Modi Charitable Clinic. Besides all these, ma'am also runs a charitable clinic at Gatkesar. So it's a privilege for Homeopathic Medical Association of Telangana to felicitate you, ma'am. You are such an inspiration to many of the homeopaths. Thank you very much. I request the audience to please stand, give her a standing ovation. I think she deserves that.
Most of us don't even have half of ma'am's experience as age. So it is really great to have ma'am. So ma'am, please share a few of your words to the audience.
Distinguished guests and all the students and fellow homeopaths. Today I would like to pass on only one message for the girls especially. We can't practice, how to practice. We can't be full practitioners. You need not be a full practitioner. Just give your 2 hours to a patient such that you sustain in the practice and be a good homeopath. You are studying for so many years and not at all practicing. Few of them, I'm not talking of everybody. Whoever is not coming onto the platform of practice, I request them, please join, practice and do for at least 2 hours. You need not do a government job. You need not do anything. You should have a service motto so that you can help the needy who are around you. That's what. And I am attached with the institution since 1975. During Dr. Sheshachari's period, I joined this institution. And till today, I am working. In between, because of health issues, I may not have come, but I am a practitioner. Even now I come on Tuesdays to this clinic, but since 2 months I'm not able to maintain it regularly. Okay, I'm thankful to all of you.
Thank you so much, ma'am, and thanks to all the dignitaries.
ये बंद है ओके ठीक है So we'll continue with the presentation. So the third case is a very important case, which is quite close to my heart because this was during my days as a medical officer in Dhavlis. So this case highlights the importance of observations again, but in neonates, because neonates, even the parents do not have any adequate data to narrate. So everything has to be based on your keen observations, and observations at the bedside have to be accurate, have to be keen, and have to be on a regular basis. You cannot see the patient once in a day. It has to be every hour, or sometimes the whole night you might have to spend with the babies next to you. Okay, so this case, sorry, is a twin baby which was referred from a PHC. To give brief account, the rural homeopathic hospital in Palghar was a referral center for most of the cases because we had recently started in NICU. So most of the patients, because Palghar was in a tribal belt, any case which had to be referred to Mumbai, which was 100 kilometers away. So this was an important step in the community service where we had started a NICU in the rural hospital. So this baby was referred to us. This was a twin baby, live baby of the twins. The second baby had already expired. And this was 850 grams. Okay, so the child which expired, the baby which expired was only 750 grams, which expired within 3 years of birth. This baby was 850 grams, and this was referred. This baby had luckily cried immediately after birth, so there was not much of scope of developing into hypoxia, but because of prematurity, extreme prematurity, and very low birth weight, the child was referred to the NICU. So the baby was admitted in NICU in view of extreme prematurity and very low birth weight. So when we come to the discussion of this aspect of prematurity, we also have to see that this case is admitted in an integrative setup. Okay, so we are not directly jumping into homeopathy for this case. We are trying to maintain at least that to see that the baby survives. That is the first motto. So when the baby is admitted in any NICU, the first motto is to see that the baby survives, puts on adequate weight, puts on good, has a nutritional status. So what is the main purpose and what is the main outlook for such cases. The lung compliance in premature neonates is very low, and hence has high chances of hypoxia or anoxia. So since the baby had cried already, there was no evidence of birth asphyxia, but the baby can go into hypoxia or anoxia anytime. Okay, so the baby has to be monitored regularly and with IV fluids and continuous oxygen. But and the baby was responding to the management quite well. So this continued for more than 2 weeks. So on the 17th night, okay, so as most of you who have worked in IPD setup, you always come across this incident of the IV line going out. Okay, so this baby also, 850-gram baby, you almost imagine there hardly any veins visible. So with that, we have to maintain a good IV line to secure and stabilize the baby and to continuously give those IV fluids in a moderate doses. So this baby had a small blister at the site of the IV line, which was on the dorsum of the left foot, probably due to extravasation of the fluids. The surrounding area turned black. Okay. So by the morning, the area had developed 2 to 3 more blisters on the left foot with erythema and edema of the entire foot. The treating pediatrician advised for local application of Poviclean and T-Bact ointments. Because the child had still not developed any signs of any septicemia, this was a localized sector which had to be looked into. So the pediatrician also was very cautious and he only advised for local applications. A surgeon's opinion was sought. He said that the baby is already developing a necrotic patch. So he advised for daily dressings. Now, the baby who was almost doing well for the last 16 days, on the 17th day, unfortunately, because of the IV line going out and the vessels are quite fragile, the extravasation is a common finding. But what was peculiar in this baby was that a small amount of extravasation had led to a rapid succession of blisters, right? And necrosis setting in within few hours, okay, which was now prone to getting infected also. Okay, so the pediatrician advised for topical antibiotic ointments as it was still a local pathology with no effects on the general condition of the baby. The baby also received IV antibiotics. The surgeon advised continuous dressing. At this point of time, it was necessary to be prepared to face the complications because the baby might land into septicemia anytime, also almost compromising the life of the baby, and to tackle any complications if they arise. So what could be the complications of such necrotic patch? Okay, there could be a progression of the necrosis, septicemia, and if the bone gets involved, because hardly you see at 850 grams baby, the skin and the muscles, there's not much distinction available there. Okay, so the next thing which is available under the patch is the bone. So there are chances that the bone might also get infected with osteomyelitis. So this was the picture of the baby. You see this, sorry. You see this patch on the dorsum of the foot, which I have described already. You can see this in larger picture. So at this point of time, we have to again, for the next 3 days, the blackish discoloration was same and there was mild serosanguinous discharge which had developed. Edema was same on the 21st day, that is 4 days after the, or 3 days after the patch had developed. And there was minimal reduction in edema, but the discharge was still the same. And now it is quite evident that the IV antibiotics and the local application is not working. So this is when we took up the case for trying to see whether homeopathy has any scope in this. So the baby was already under the cover of both topical as well as antibiotics, but there was still no improvement. But the baby was still not out of danger, right? So at this point of time, we have to look into other options to heal the wound and save the baby from developing aforesaid complications. If you understand the pathology, it is very peculiar to the child. It is not a common happening, right? Any IV line, even if most of you must have taken some IV shots. So if your IV line is out, they usually secure it with any secondary IV line. But the place where it is out, okay, there's quite small amount of edema, but then it subsides over a period of time. But here the pathology had developed into necrosis as well. So what are the challenges we face when we have to deal with such cases? Okay, and how do we prescribe? What could be the homeopathic outcome? And at this point, let us start with the basic concept of case taking and understand what are the salient features or coordinates of case taking in neonates. So if you understand the case taking in neonates, because like I said, parents also are not aware. The mother is not with the baby because the baby is inside the NICU and the mother is outside in the waiting area. So what has to be seen is your observations. Okay. The mother's state during pregnancy has to be taken into consideration. The clinical pathological correlation has to be established. And if there are any signs in the neonates, any reflexes which have altered or any reflexes which have still not developed, all these things comprise what is important to be understood from the homeopathic part of case taking. So let us see what we can find in this baby. So coming to the observations, what is the observation we have seen? So since there is paucity of symptoms in neonates, all these four coordinates have to be equally given importance to arrive at a totality. Because at the end of the day, we have to see what is the totality, emerging totality in these cases. And let us examine each one by one. So what is the observation of the pathology? There is swelling, there is edema, there is serosanguinous discharge, which has developed, necrotic patch, and pathology is, it is secondary to a trivial injury. Okay, and there is ischemia and death of the cell with infection causing necrosis of the left foot. We took the case from the mother's state during pregnancy, as well as few details of the mother. And we saw that the mother had dreams of snakes biting her. And this was peculiarly only during the pregnancies. And aversion to eggs, and also had recurrent aphthous ulcers. And since it is a local pathology, there are not much significant signs which had to be taken into consideration. So when we combine all this data, the observations, mother's state during pregnancy, and the clinico-pathological correlations, what we arrive is a totality which looks something like this. Okay, so dreams of snakes, aversion to eggs, aversion to milk, desire sweets, profuse perspiration, gangrenous necrosis, and blackish discoloration of the skin. And we try to repertorize this case. This is a combination of all the symptoms from the mother as well as from the baby. You see that arsenic, lachesis, ferrum, nitric acid, phosphorus, all these are coming up as the prominent remedies. And we see what is happening only to the baby. If you try to delineate and take up only the cases or the symptoms from the baby, we see that gangrene and the discoloration which is there. So if we separate the baby and the mother as well, so we see that lachesis still stands out. So the remedy which came up prominently was lachesis. Now, the next question which comes is what next? So since lachesis is covering both the mother's state during pregnancy and it covers the pathology of the baby, it was the final choice. And the next question which comes is whom to give and how to give. Main point after selection is the posology and the dosage and the regulation of the dosage. So before going ahead, let us understand the concept of mother and child. Okay, mother and child as a concept is a single unit. Okay, most of you will agree with this, that apart from the separation of the umbilical cord, it still remains as, that is why we consider giving the breast milk as soon as the baby is born, so that the bonding between the mother and child on the baby, which was there for 9 months, is suddenly not cut off. It still continues to nourish the child. Apart from the cutting of the placenta or the umbilical cord, the nourishment still continues and the bonding develops into a good mother and child bonding. So here you see that the mother and child is a single unit. So it clearly depicts that all the baby is separated from the mother physically. It is not completely a single or separate entity in altogether. And this will, the mother state during pregnancy will definitely have an effect on the baby, although it is now a separate individual physically. So what comes to us to help is Dr. Henneman's observations. And in the footnote to 164 to aphorism number 284, he reads, and I quote, "The power of medicines acting upon the infant through the milk of the mother or wet nurse is wonderfully helpful. Every disease in a child yields to the rightly chosen homeopathic medicines given in moderate doses to the nursing mother and so administered are more easily and certainly utilized by these new world citizens than is possible in the later years." So now it was quite obvious that Hahnemann has come to our rescue to take a decision in this difficult situation. So it was decided to give lachesis to the mother. We started with lachesis 32 doses and then we stepped up to 204 doses over a period of 2 or 3 days. Now the first follow-up after the shifting of the doses up to 200 is that the size of the necrosed area is decreasing, erythema is decreased, and there is regression of the necrosed area. This is the front picture of the same foot. You see the edema has considerably come down, the discharge has come down, the size also is slightly reducing. And now the wound has ulcerated appearance with raised margins and yellowish slough. Once the scab, which had a dead tissue, came off, what was lying beneath was this area of ulcerated appearance, okay, which was again hidden. And later the dead tissue peeled off, leaving an ulcerated area with raised margins and no granulation tissue. So just when we were thinking what is the role of lachesis and how to proceed with the case, one interesting coincidence happened is that the mother developed severe toothache with a swelling of the cheek and submandibular region with fever. She had difficulty in opening mouth. The pain was aggravated by touch of food, and the totality after hepatization suggested Merksol. And since Merksol was also a followable remedy for lachesis, so we have to look at all the perspectives of looking at the simillimum and what follows well. And here Gibson-Miller's chart at the end of the Borix Metiremedica comes to help. And we see that Merksol is a good followable remedy for lachesis. So we prescribed Merksol 200 QDS for the mother, which took care of the mother's toothache, and the baby's wound also started improving gradually. So this is after the Merksol. You see, the necrosed area is totally gone. The healthy tissue has developed, and there's good amount of dermis which is developing. And baby with the healing wound, the baby is developing nourishment also is quite fine, and you hardly see any dead tissue left now. You can see these pictures, just small speck of the scar tissue which is left out. So it was worthwhile mentioning that throughout these medicines have been given to the mother and not to the baby. And it has been dynamically receiving these doses of lachesis as well as Merksol through the mother's milk. The baby was overall showing signs of improvement, developed a good sucking reflex. So the Thiel's tube also was taken off. The mother was directly given to the mother for the breast milk, and it was able to maintain temperature. The wound had completely healed. So the baby was shifted out of the NICU to step-down NICU, where after assuring that the vitals parameters were maintained appropriately, the baby was discharged after 60 days in the hospital. So this is quite a number of days to stay in the hospital. And overall, after that episode, also the baby didn't have any other signs of fever, and the baby healthily improved. And on discharge, baby after 60 days was 1.8 kgs. What is the final outcome we see? The mother received constitutional medicine after her toothache was relieved and the wound of the child had healed. The baby followed up a few regular visits and then discontinued. But we kept a track of the baby, and following photographs indicate that the baby has been doing quite well and attaining age appropriate milestones. So we kept in touch with the baby's parents. And this one thing which I want to stress upon is this baby was coming from a very poor tribal background, where the parents could not afford NICU admission. So all those payments of the NICU was funded by crowdfunding. Okay, so crowdfunding helped this baby to survive. So this is at 6 months of age. This is the first birthday. And the child is at 2 years of age. If you can see closely, there's hardly any scar left. Here, I would like to stress that pediatrics and especially neonatology is not one man's play. It has to be a team coordination, a healthy discussion at each point of time. After seeing each follow-up, you have to discuss with all the team members, including the allopathic physician, all the pediatrician, the surgeon who has to be taken into confidence. And this is possible only an integrated medicine, which is the need of the hour. Okay. So what are the take-home lessons for today's presentation? Is observation is the cornerstone of pediatric homeopathy. A keen eye can unlock the individuality of the child. Training observation improves both accuracy and speed in case taking. Okay, you might take the case for half an hour, 45 minutes, but what clicks is your observation. And if you include this into your totality and try to repertorize and try to find the right rubric, you might come to the right simillimum as well. So thanks to the management of JIMS Homeopathic Medical College, especially Dr. Naveen Bhaskar sir, who has been the cornerstone for all these success stories, and to entire PG group, interns, and the students who have been helping us in this journey, and especially to the parents who have allowed us to be the part of their enduring journey. Thank you very much. I thank HMAT for all the support they have granted to me and for inviting me to this platform. I thank everyone in this. Yeah. We could have thought of it. Internal also, because the child was already on Ryle's tube feeding. We could have given in that sense also. Mother could have received it separately also. Separately. Okay. Any other questions? Thank you, one and all. Yes. The child, when the parents described, is very curious about everything in this house, in the house. He keeps asking number of questions. He keeps waiting till the answer is not satisfied. And he has a lot of curiosity to know a lot of new things which are around him. So that is the only thing that we have considered as a rubric, curious.
To know the things.
Yes. Yeah. See, autistic children, as you must all be knowing, have a little more intelligence. And this child also is very intelligent. His mathematical skills are quite exceptional. When we tell him that your next follow-up is after 3 weeks, he immediately tells the next date when he has to come without looking at the calendar also. It is very good at maths. His tables are excellent memory he has. IV antibiotics were given for that particular course of time, after which the pediatrician said, I don't have any role to do now because the necrosis has taken care, and it wasn't helping. So it was only homeopathy which was continued till the wound was healthy. Allopathic course was given for the entire course of duration, whatever is prescribed, and after the baby as well. We didn't think of, because it was the serosanguinous discharge was already quite progressive, and we didn't want to change the pattern of the appearance of the. You could have looked for some other signs and taken up a new totality which could have helped it. If the totality is matching both the mother and baby's totality, antenatal history, mother's state during pregnancy is matching, and the totality is quite indicative of the simillimum, then we can definitely use it. Thank you one and all for your patience listening.
Thank you, sir. Thank you, sir. Thank you for your enlightening session about pediatrics and case taking in pediatric age group. Now I call upon Dr. Venugopal Gauri, sir, for the concluding remarks.
President of the Association, Dr. Gopal Krishna sir, Secretary, Dr. Durga Prasad Rao sir, senior members of our association, sponsors, Dr. Manik Prabhu, and all the young homeopaths of Twin Cities, my elder brother like Dr. Srinath Rao, professor at GIMS. Thank you for coming here this evening. And thank you, Dr. Irfan, for a beautiful presentation this evening on pediatrics. As a matter of fact, when it comes to pediatrics, it has to be more of observation, and also we have to totally rely on the information that is given to us by the parents of the young infant or the neonate, or for that matter, a child. So the beauty of homeopathy is it can act when it is administered through breast milk, or a drop of dilution on the tongue, or it can be given orally. That's the best part of homeopathy, and it is absolutely safe, and it does not cause any side effects. And the beauty of today's presentation was Dr. Irfan's presentation of the third case, wherein he elucidated where we can match the symptoms of the mother and the symptoms of the child also. And when it matches, probably the efficacy of the medicine is doubly beneficial, both for the mother and the child. So that gives a new insight this evening. And also for as a matter of fact, the following remedies, which we always think that one remedy is supposed to do the job, but let us face the reality. It has to follow up with something else. And as again, Dr. Irfan said, the Boric Materia Medica gives us a chapter wherein we have clearly where it says what are the complementary remedies, what are the remedies that follow well, and what are the inimical remedies. And we should take an opportunity to open that page, and when we find some good relief with the patient and something to go on, and if the pathology of the symptom of the particular child is there, I think we should follow up with those remedies, and it is greatly beneficial. I'm a student of Dr. Shiv Shankar sir, and I worked with him before I actually started my practice 30 years ago. And that is exactly what sir has been saying all these years. Give follow-up remedies. Sulfur, you find that the symptoms are matching. It has helped to a great extent. And if the skin is dry, follow it up with sarsaparilla, and it has done a good job. Then it's still not completely done. You can think about sepia, sulfur, sarsaparilla, sepia. So something like that. So the beauty of homeopathy is there are many matching remedies, and remedies that complete the action of the previous remedies, and we should look into those. And also, I was just meditating on what Dr. Mohammed Irfan would speak this evening.
and I, happened to read a few pages of Douglas Borland's Types of Children. And very beautifully, that gentleman elucidates about how these remedies work well on the children. If you have a very lazy and a fat, flabby child, lethargic child who is not willing to move, who is shy and reserved, you will always think about calcare carb. But if you have a fat and flabby child who is willing to move and who is making an effort to move, and you think about calcarea phos. And if you have a child who is willing to move further and but develops pains, you think about silesia. So a similar physical constitution, different efforts from the child. If you can observe that child, you can give one of these remedies. And if you have a calcarea carb child, the most of the center of problem would be somewhere in the tonsils and the lymph nodes in the ENT area. And if it is a calcarea phos child, the action result moves on to the adenoidal area. And typically the calcarea phos child also has the adenoidal phases. And if it is silesia, you have more glands involved. And if it is phosphorus, you will find that the inflammation or the infection has moved on from the tonsils and the adenoids and later also into the lungs. So the beauty is when you keep reading Materia Medica and you can observe the changes in children, and if you can keep applying these remedies, they can come in very, very handy. And that autism case, what Dr. Irfan was saying, if you can also look at the causations, like what the hypothesis of the day that is going on, what is the reason for the toxins build up in the children, what is the reason for the ADHD. And when I studied about autism in 1991 in my final year of medicine at Gulbarga Homeopathic Medical College, there was hardly any place for autism, and it was not expected to be asked in the question paper. But today, I think you can get a essay on that. So times have moved on, and so need to be our study about what is going on in the clinico-pathological areas. And we need to apply more of this knowledge for the betterment of our patients and betterment of homeopathy. And Dr. Irfan has beautifully pointed out that we need to be a partner in the game of seeing that the patients get through to betterment swiftly. And when it comes to pediatrics, we need a lot of inputs from our fellow pediatricians from the other fields of medicine like allopathy. And sometimes it is very shuddering to imagine to be working as a pediatrician, because you are supposed to know a lot and you have to work in an NICU, and it will become very intimidating sometimes when you don't have enough knowledge to shake hands with a pediatrician of the other specialties of medicine. So we need to pull our socks with hearing to good people like the speaker this evening. And I'm sure all the youngsters here have a great things to learn, as do homeopaths like us who have been in practice. And we look forward to having more presentations like this in the days to come. Thank you, one and all.
Thank you, sir. Now I call upon President of our association, Dr. Gopal Krishna, sir. Dr. Durga Prasad, sir, General Secretary of our association, onto the dais. I call upon Dr. Venugopal Gauri, sir, Treasurer of our association, onto the dais. Sponsors of today's oration, Dr. Manik Prabhu, sir, onto the dais. Dr. Murli, sir, please come onto the dais. I request Dr. Raghuram, sir, to come onto the dais, sir. I even call upon Dr. Kaladar, sir, onto the dais. Now I request speaker of today's evening, Dr. Muhammad Irfan, sir, to receive the felicitation. Thank you, sir. Now I request the dignitaries to felicitate the sponsors of today's evening, Dr. Manik Prabhu, sir, and family. I request the family members also to please come on to the dais. Dr. Sarika. We have been conducting the oration since many years, and interesting topics are being dealt with in each oration. And we as an association promise you that many more interesting topics will be awaiting in the next coming sessions. Now I request Dr. Raghuram sir for vote of thanks.
Professor Dr. Muhammad Irfan sir, thank you for your wonderful presentation on the topic relevance of observation in pediatrics. We are very insightful and very helpful speech today, sir. I also thank Dr. Murli sir for accepting our invitation to felicitate you, and also Dr. Annapurna ma'am, in spite of advancing age, to come and grace this occasion. We also thank the sponsors of today, Dr. Manik Prabhu sir, for this wonderful oration. Also thank Team HMAT. Thank you so much.